How do doctors distinguish CFS, me, from other fatigue-related illnesses? Imagine feeling exhausted all the time, but your fatigue isn't just from a busy day or lack of sleep. Doctors face a challenge in figuring out if it's chronic fatigue syndrome or something else. To do this, they're relying on a detailed process that involves listening carefully to your story, doing physical exams, and running tests to rule out other causes. There isn't one simple test that confirms chronic fatigue syndrome or myalgic encephalomyelitis. Instead, diagnosis depends on specific symptoms and making sure no other health issues are causing your tiredness. First, doctors look at how long your symptoms have lasted. For a diagnosis of chronic fatigue syndrome or myalgic encephalomyelitis, symptoms need to have been present for more than 6 months. They check if you have a significant drop in your ability to do daily activities compared to before you got sick. Key symptoms include profound fatigue that is new and not caused by overexertion, and it doesn't get better with rest. A hallmark feature is post-exertional malaise, which means your symptoms worsen after physical, mental, or emotional activity, something that didn't happen before you became ill. Unrefreshing sleep is also common, meaning you wake up feeling just as tired as when you went to bed. Doctors also assess cognitive issues like memory problems or difficulty concentrating, and orthostatic intolerance, which involves symptoms like dizziness or lightheadedness when standing up. Next, they perform tests to rule out other health problems that can cause fatigue. These tests include blood work to check for anemia, thyroid issues, diabetes, or signs of inflammation. They might do sleep studies if sleep disorders are suspected, or tilt table tests if symptoms suggest problems with blood pressure regulation. Sometimes, additional tests are needed to exclude autoimmune diseases or infections. This thorough process helps ensure that fatigue isn't caused by other treatable conditions. Doctors also look for a pattern of symptoms that are typical of CFS or ME. Besides fatigue, they check for symptoms like muscle or joint pain, sore throat, tender lymph nodes, headaches, and sleep disturbances. The presence of post-exertional malaise is especially important because it is not typical of most other illnesses that cause fatigue. If your symptoms worsen significantly after exertion, that's a strong clue pointing toward CFS or ME. Some clinicians use standardized questionnaires to support diagnosis. These tools help document symptoms and assess their severity. Researchers are also exploring advanced diagnostic methods like 2-day cardiopulmonary exercise testing, but these are not yet routine in clinical practice. Finally, because symptoms can change over time and other health issues might develop, doctors recommend ongoing monitoring. Reassessing symptoms periodically helps confirm the diagnosis and guides treatment. In summary, doctors distinguish chronic fatigue syndrome or myalgic encephalomyelitis from other illnesses through a careful combination of symptom assessment, exclusion of other causes, and recognition of characteristic features like post-exertional malaise and unrefreshing sleep. This comprehensive approach ensures that each person receives the right diagnosis and appropriate care. If you suspect you might have CFS or ME, it's important to consult a healthcare professional who can evaluate your individual situation thoroughly and help develop a personalized management plan.